Sta rientrando. Hello, everyone, and welcome to this webinar from DEKA. Today, we're talking about Luxea. It's your X-Factor modular platform for limitless possibilities. The official language of the webinar for both presentation and question is English. Our speakers of today are Professor Paolo Bonan, ESLD Key Officer, EADV member, Adjunct Professor of Laser and Plastic Surgery, University of Siena, and in charge of Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence, Italy. Joining Professor Bonan, we have Dr. Michela Troiano, dermatologist, assistant at Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence, Italy. During the webinar, you can send your questions by acting on the question push button on the comment screen. The question will be answered at times at the end of the webinar or in the following days directly by our speakers. For questions relating to technical and logistic details instead, the team will be promptly answered to you right away. Now, I have the pleasure and the honor to give word to our first speakers of today, Dr. Michela Troiano. Enjoy the webinar.
Thank you, Simone, and good afternoon to everybody. Welcome to Luxea webinar, and welcome into a new area of laser platform. Luxea is the newborn in DEKA laser family, and it's a revolutionary device which has completely changed the concept, completely changed the panorama of body platform, because it's an all-in-one solution workstation with limitless possibilities of configuration. It's a modular, expandable, and customizable machine that can be connected to different intense pulse light, to different kind of laser, radio frequency, and even a diode, and these permit us to treat a very wide spectrum of diseases. Thanks to the possibility to build our machine, so decide which kind of piece we can add to our platform, and the possibility to expand our machine even during the time, make this platform very, very nice. It's an amazing aspect of this device. And these permit us to satisfy a lot of patient requests and even a lot of physician needs. Luxea is able to treat inflammatory acne, skin laxity. It's able to remove tattoo. It's able to treat onychomycosis, photo rejuvenation and wrinkles, pigmented lesions, hair removal, vascular lesions, but it also satisfies physician needs thanks to the possibility to have different intense pulse light, which are different and the filter. And these permit us to treat a very wide spectrum of diseases, but also they are different in lamp size. These permit us to treat even areas that normally are not so easy to treat with a bigger spot, and they are also different in the shape. So we have two different pieces, emerald and amber, which are UPL, and this UPL means that they have mirrors inside, that they are able to capture the energy that is normally lost during a traditional treatment and to convert back the light in a space. So we can give a more stronger action. These are the technical features of the machine, but who can be interested to this machine? Uh, well, first the younger physician, maybe someone who is approaching for the first time to lights and laser, because he wants to find something that it's able to treat a wide spectrum of diseases, and at the same time it has the possibility to expand even during the time the machine, and to expand also his field of application. Moreover, the system is pretty slim, so if we have a small office, we can put everywhere and change all the end pieces. But also the physician who has another device, for example, a CO2 laser, and he is not sure if it can be more advantageous to buy an Nd:YAG or a Q-switch laser, and buying this platform, he can have with two different end pieces, two different important sources that permit to treat pigmented lesions, tattoo removal, vascular lesions, onychomycosis, skin tightening, and hair removal. But also, so I think that Luxea can be an answer also for him, but it's also an answer for the expert, because we have particular end pieces, in particular inside, which can improve the quality of our work. So it can refine the quality of our work, for example, with a CO2 laser. So it represents an incredible opportunity for the clinicians to have a 360 degrees versatile tool able to treat many skin problems. So let's see the end pieces that can be connected to Luxea, to the body of this platform. We have 7 different intense pulse lights, 4 different kind of laser, a diode, and a radio frequency. The intense pulse lights, as you can see from these lights, they are different in the filter, and these permit us to treat a wide spectrum of diseases. And for sure, lilac is the end piece that it's able to meet more patient needs. The others, such as viridis, lazur, rubber, they are more selective for a particular problem. The laser that can be connected to the machine are an Nd:YAG 1064 nanometer sparks for the treatment of vascular lesions, onychomycosis, skin tightening, hair removal. Inside, which is a non-ablative fractional laser, Nd:YAG 1340 nanometer for the treatment of skin rejuvenation and acne scars. We have Prisma, which is a Q-switched 1064 for 532 nanometer for tattoo removal and pigmented lesions, and Arise, which is an erbium 2940 nanometer, which is able to treat, to vaporize, to ablate, but also to do a fractional and a traditional ablative skin resurfacing. We have a diode, Vivid 810 nanometer for hair removal, and a radio frequency, say this 1 megahertz for skin rejuvenation. The intense pulse lights that can be connected to the machine, they are equipped with different emission spectra filter, which permit us to treat different problems, different kind of phototypes. They are different in shape, so we have the two end pieces, emerald and amber, which are UPL, and they are different in lens size, because we will see that in particular areas, such as, for example, the areas of the nose, the bigger size of the lamp does not permit to treat very well, and sometimes we can press too much the vessels, reducing the effectiveness of the treatment. The intense pulse lights, they are also equipped with a cooling system which improve patient comfort. And we have also two different techniques of working. So we can work in a stationary way. So it means a single pulse, a single pass shot by shot, or we can work in motion. So using minimal energy in order to reduce the pain and passes several times into the same area, which for convention is a square 5 by 5, until we have reached the end point. Normally, we need about 8 passes to reach this end point. The large band of emission leads to interact with melanin for the treatment of pigmented lesions and hair removal, but also hemoglobin, so for the treatment of vascular lesions. And the higher wavelengths permits also to determine a thermal dermal stimulation of collagen, because these higher wavelengths are absorbed by the water which is contained in the dermis and triggering a cytokine reactions, which in turn stimulates the formation of new collagen. But before starting to describe each technology singularly, I would like to spend some words to the pulse shapes, to the preset pulse shapes. Sure, it's possible even to select by ourselves the pulse shape, but the machine has preset pulse shape: a short, medium, long, and motion. This is important to increase the to maximize the effectiveness of the treatment and to reduce the risk of possible side effects. So the pulse shapes can be short, medium, long, motion, and normally we use the short for the treatment of brown spot, because if we want to remove a spot, we need a very short and intensive pulse. If we have to treat vascular lesions, we normally use the medium, while if we have to treat hair removal, we can use the long, or eventually we can use in motion. For the treatment of acne, we will see that the pulse shapes depend on the phototype of our patient. The procedure is pretty simple. So the first thing to do is to select the right filter depending on the phototype and depending on the lesions we want to treat. It's not necessary the application of an anesthetic cream, because these can alter the perception of our patients, so we have more risk to damage. And in case of darker phototype, we have to use the greatest filtering and multi-pulse emission, increase the delay between pulses, more conservative parameters, and if it's possible, use the motion technique, especially for hair removal. The contraindication are all that situation in which drugs, medications, creams, diseases can increase the sensitivity to light. If the patient is pregnant, if it has been exposed to the sun in the weeks before or is going to be, or if she has a personal history of skin cancer. And which are our endpoints? Well, this depends on our target. So if we are treating, for example, hair removal, in this case, our endpoint will be the reddening, but also the perifollicular edema. In case we are treating vascular lesions, we will observe a slight subpurpose erythema associated with the sensation of heating. In case of pigmented lesions, a slight darkening of the lesions itself, and also a slight erythema. In case we are treating for skin rejuvenation, slight erythema and a sensation of heating, and if the patient, we have always to ask to our patient what she's feeling. So if she starts to feel discomfort, we have immediately to stop the treatment. The possible adverse effects such as blistering, scarring, pain, hyperpigmentation are probably due to very high parameters. So we suggest to start with low fluencies with lower parameters and then increase. So let's start to see each technology singularly, starting from Viridis. Viridis, it has an internal filter at 500 nanometer. It's a particular filter which is able to focalize energy to wavelengths such as 532, 585, 600 nanometer, which are dedicated to vascular application. And these permits, as you can see from these images, this permits to increase the selectivity for vascular lesions. So this kind of filter is able to, let me pass this word, remove the non-vascular wavelengths. So we don't increase the temperature where it's not necessary, and we can increase the parameter for removing vascular lesions without causing any kind of side effects. This has a kind of end piece. Has a very small end piece, as you can see from this picture. And if we have to select the pulse shape, normally we use the medium pulse shape, but we will see in the picture that I'll show you that if we have to treat very small vessels with the same energy, we have to use a more intensive and short pulse to obtain the coagulation of the vessel. So these are the parameters that are normally used for Viridis. The fluence range around 13, 14. We can reach 25 joules per centimeter square. It's the maximum. We use a pulse shape, a medium pulse shape, sometimes a short pulse shape. For poikiloderma, a long pulse shape. So as you can see from this image, you can appreciate the improvement, the reduction of these erythema, and you can appreciate better in this picture, which was performed with Quantificator, which is a 3D imaging system which is able to underline the hemoglobin component, but also the melanin component. In this case, the melanin for sure. And so you can appreciate the improvement before and after treatment. And here you can see the treatment of very small vessels of the nose. That's why it's important, the small area of treatment, because otherwise in this area, it's not possible to treat with a normal lamp size, okay, which is normally around 5 centimeter. And you can see before and after treatment using the fluence of 16 joules per centimeter square with a short pulse before and after treatment. Lazur is the second end piece we can connect to Luxea. It has an internal filter at 400 nanometer, and these end pieces, it's great for the treatment of active acne and papulopustular rosacea, but it's not recommended for comedones and nodal cysts. You can maybe criticize the use of an intense pulse light for for acne, because we have a lot of creams and tablets that can be used for the treatment of acne, but it's also true that there are no responder patients, and there are also patients who deny systemic or daily local treatment. For example, a female patient in the fertile period. Why this 400 nanometer is able to act on acne and papulopustular rosacea? Because Propionibacterium acnes synthesize and it's able to store porphyrins. This blue light, it's able to interact with porphyrins, and it's able to, once it has excitated from this blue light, it produces reactive free radicals and singlet oxygens, which in turn causes membrane damage in P. acnes. So it's responsible of the destruction of P. acnes. It also has a small anti-inflammatory effect. And which kind of pulse shape in this case? Well, depends on the phototype. Okay, so for the first phototype, we use the short. For the darker phototype, medium or long. And here you can see after 8 sessions, once a week, before and after treatment, the reduction of acne. You can appreciate better from this image. And again, the left side, before and after treatment. Yeah, well, this is a waiter. He's not a female for sure. He's not in his fertile period, but he's a waiter. He used to work close to the sea, and he wouldn't like to undergo to a treatment with tetracycline. So we performed the treatment with Lazur, and this was the result. Lilac is for sure the end piece that it's able to meet more patient needs, because it has interchangeable filters at 500, 500G, 550, 650, and a particular filter called SA, which is at 830 nanometer. So this kind of end pieces, it's indicated for the treatment of pigmented lesions, photoaging, vascular lesions, hair removal, acne, dry eye disease. You see, depending on the wavelengths we select, we can treat at different problems. I'm sorry. In this case, the pulse shape depends on the lesions we are treating. So if we want to treat a spot, we have to use a very short and intensive pulse. If we have to treat a vascular lesions, a medium pulse shape. If we have to treat hair removal, we can use the long pulse shape, or it can be used in motion. For a few words about SA filter, which is a 830 nanometer. This kind of filter, it's great for the treatment of photoaging, but for a particular kind of photoaging with no spots, no vascular lesions, but only wrinkles and lines. So it can be suggested for example, for the treatment of the neck. And it can also be used for the treatment of acne. So it's great for dilate pores. Why it's useful for photoaging? Because we are in the near infrared. So this is able to it's able to produce a quantity of collagen that is higher than that one that is produced by a normal IPL. And it's also able to treat acne because of its anti-inflammatory effect. Why? Because it interacts less with porphyrins, but it's able to go deeper into the tissue. So it's able to act directly on the sebaceous gland. So here you can see the improvement before and after treatment in oiliness and also dilatate pores. Again, on the right side. And this is a patient that was treated using the SA filter. Only one session we performed. She was very happy because you can see, you can appreciate after the only one treatment, the improvement. Which are the parameters when we use SA? We can start from 10, 20 watts, but we used to work at 30 watts. We have to apply a gel. We have to pass several times in an area which for convention is 5 by 5 because we use this filter in motion. So we have to reach 41 degrees. We used to perform 2-4 treatments with an interval of 2-4 weeks, but we can also ask to our patient what she's feeling, and when she starts to feel discomfort, we have to stop the treatment. And here you can see the treatment of the neck. I have a short video to show you. The treatment is pretty simple. We have to divide the area in a square 5 by 5. Consider that the length side is about 5, the longest side is about 5 centimeters. So we proceed by passing several times into the same area until the patient asks to stop the treatment, until we observe the redness. We have to apply the gel. So when we see the redness and the patient asks to stop the treatment, we have immediately to stop it. So here you can see the endpoint, our redness and the temperature at 41 degrees. You can criticize this image, I know, because we used a red pencil, but you can see in the other area in which we didn't divide the in squares, you can appreciate the erythema. So this is the endpoint. This kind of filter can be used for photoaging because it's able to produce more collagen than a normal IPL. But when the photoaging starts to become worse, we have to shift from SA to inside, which is a non-ablative fractional laser. And it's possible the combination of SA and Laser because it's able to interact with porphyrin, and so it's able to destroy P. acnes, and SA because of its anti-inflammatory effect. So this SA, I think it's pretty nice for the treatment of the neck and dilatate pores. So let's see some clinical images of patient treated with lilac and pieces. First, I remind you that if we have to treat pigmented lesions, we have to first select the right filter depending on the phototype of our patient. For sure, we have to select the right fluence, but the fluence, we can increase the fluence reducing the phototype, and we have to use a very short and intensive pulse. And here you can see the improvement before and after treatment. Before and after treatment with a 550 nanometer. The endpoint is the redness and the darkening of the spots. Before and after. Again, the treatment of brown spots in a darker phototype, so we need to use a 550 nanometer. On the right side, before and after. And this is a lighter phototype, so maybe we can also use the 500 nanometer. In this case, we use the 550, and you can appreciate the disappearance of the spot. With quantifier, we can underline the melanin component, and you see on the cheeks and on the upper lip the improvement before and after treatment. Another case, before and after, the disappearance of the brown spot, and also the improvement of the skin in general. Again, same patient. Another patient, before and after treatment. This is a pretty nice image in which the patient performed 4 sessions at 12 joules on centimeter square. We use lilac 550 nanometer with a short pulse shape, and you can see the improvement after 4 treatment sessions, before and after treatment. And this just to show you which are the steps, okay? So what happens step by step? At the beginning, before the treatment, immediately after the appearance of erythema and the darkening of the spots, the appearance, the formation of this adherent and brown crust, then that they fall out, and we have the completely disappearance of the spots. It's also possible to treat with the 500G the erythrosis and facial telangiectasia. In this case, we have to select the medium pulse shape. So 500G as filter, pulse shape medium. And here you can see after the treatment, the disappearance of the vessels. You can appreciate better with this quantifier, which permits us to underline the hemoglobin component before and after. The other side. In case we have to treat poikiloderma, we have to select the 500 filter, also because we don't have only a vascular component, but we have also a pigmentation often, and we have to use a long pulse shape. Before and after treatment, only 1 session. Well, in case you have in your clinic an oculist, it's possible also the treatment of the dry eye diseases. So using the 500 nanometer with a long pulse shape, performing 2 sessions with IPL, it's possible to improve this problem. Ruber, it's another end-piece that can be connected to Luxea. This is a particularly selective filter because it has an internal filter at 550 nanometer, but his indication is for hair removal. So in this case, we can work in a standard way, so shot by shot, using a long pulse shape, or eventually we can work in motion. So we have to treat a square, which is for convention is 5 by 5, performing about 8 passes until we observe the endpoint, so the redness and the perifollicular edema. So in this case, the pulse shape can be long if we use in the standard way, or in motion if we are working, passing several times into the same area. Same thing for Genius AX, which has instead a filter at 755 nanometer. Also in this case, it can be used in motion or in a standard way with a long pulse shape, and a wide area can be treated. Well, amber and emerald are the last 2 and pieces that can be connected, intense pulse light in pieces that can be connected to the system. They are UPL, so they have a U shape. This means that they have mirrors inside, which are able to capture the energy normally lost during a normal treatment, and they are able to convert back this light in a space. So we give more energy in a space. This means that the treatment is stronger. So even if the fluence can reach 17 joules per centimeter square, it's important not to reach these fluence, because otherwise we can damage. So normally we work around 7-10 joules per centimeter square. It's better to maybe pass 2 times crossing the shot. And it's indicated for pigmented lesions, hair removal using a standard way or in motion, or eventually for vascular lesions for darker phototype. Emerald, again, is a U shape, but the filter is at 500 nanometer. So it's used for the treatment of pigmented lesions and vascular lesions. So in this case, the pulse shape depends on the on which is our target. So if our target is a pigmented lesions, we will use the short. If the target is a vascular lesions, the medium, long, and motion for hair removal. So here you can see the parameter that we normally use. So we use for pigmented lesions, we used to use for pigmented lesion amber with a short pulse shape. In case of erythrosis and facial telangiectasia, we use emerald in a medium pulse shape. In case we are treating hair removal with amber, we can use in a standard or motion. In case we are using in a standard way, we'll use the long pulse shape. We can also connect to the body of Luxea, even a radio frequency, which is called SATIS, and a diode vivid. The SATIS, it's 1 megahertz radio frequency. It's pretty similar to that one that DEKA had in Triactive. And it has different tips, interchangeable tips, a very small, a medium, a large, and an hexapolar. Is a multipolar technology. So it's different from the radio frequency you find normally on the market, because it's not a monopolar in which the current flows through the body from the active electrode to a return electrode on the lower back of the patient. So the treatment, it's very nice for tightening, but it's not a particular safe procedure. And it's not a bipolar technology in which the current flows through 2 electrodes. So, and the treatment is superficial. In this case, the treatment is superficial too, but the area of treatment is bigger, because we have 3 electrodes or 6 electrodes. Okay, so the current flows through these electrodes, and we reach about 42 degrees. This kind of treatment is recommended for skin laxity of the face and the body. In this case, the endpoints are 2. The first one is the temperature endpoint, which is normally used when we have to treat small areas, such as the face, for example, or it can be the time. The time is normally 10 minutes when we have to treat larger areas. So in case we have to treat the face, we can work with a very small or with a small. With a very small, normally we work at 3 watts, and then we can increase up to 10 watts because they are more delicate area. So we have to reach our endpoint, which is in case is the temperature. So we have to reach 40 degrees. And when we have reached this temperature, we have to maintain this temperature for about 3-5 minutes, depending on the end pieces we are using. So normally we divide the face in these areas, and we will use the very small for the treatment of the upper lip and the treatment of the around the eyes, or the area around the eyes. In case we are treating the cheeks, for example, we will use the small one. You can appreciate the improvement. We have to apply a DEKA emulsion. We have to perform circular movements until we have reached the temperature, and then maintain for some minutes. This system can also help us to reduce the congestion of lower lid bags, and we can also treat the abdomen area. In case we have to treat the abdomen area, we have to divide the abdomen in two sides, and for each side we have to divide two areas, so the upper and the lower part of the abdomen. We can use the large end piece or the hexapolar with a power range around 20-30 watts. The same parameter can be used for the treatment of the buttock and lower limb, and we can also work for the skin laxity of the arms. In this case, we can use the medium end piece or the large end piece. And here you can appreciate the improvement. We can also treat the neck, and we can also treat the décolleté area. The Vivid is the last non-laser technology that we can add to the system. It has a filter at 800 and 810 nanometer, and it's indicated for hair removal. We can work in two ways. So we can work in a stationary way, performing a single pass with effluents which range about 20-35 joules per centimeter square, or most of the time we can work in motion, especially for darker phototype. In this case, the fluence is around 6-10 joules per centimeter square. What is this accumulation energy? Well, the accumulation energy is the dose that I need to irrigate to observe my endpoint. So my erythema and my perifollicular edema in rectangular, which for convention is an area of 10 by 15, so 150 centimeter. This accumulation energy can go up to 5,000 joules. Sometimes the clinical endpoint is observed after, so maybe we need 7,000 joules. So in this case, how we can proceed? In this case, we can divide the accumulation energy into each one of 3,500 joules and perform in the same square 10 by 15 to accumulation energy. It's important to perform slow movements in order to reach faster the endpoint. And here I have a short video to show you. No, we can't see what's going on. Okay, so we have to shade at the beginning. Then we have to divide the area in rectangular 10 by 15. At this point, we sprayed an ultrasound gel, a transparent ultrasound gel, and we perform very slow movements in the square until we observe the erythema and the perifollicular edema. So you can appreciate from this video the endpoint. Well, I have concluded my presentation. I want to thank everybody, in particular Simone and all the DEKA staff.
Thank you, Dr. Troiano, for this very exhaustive part of the presentation about the Luxea. Now, this is the end of part one. We will proceed in a few while with part two, introducing our new speakers. Just a few notes about the range of handpieces we have been looking at till this moment. Due to the huge variety and choice of the handpieces, not all the handpieces presented are introduced in all the markets. So you might find differences in terms of configuration of your Luxea device market by market, primarily depending on regulatory and homologation issues over there. Let me conclude a very fast anticipation. Luxea family of handpieces will be joined by another of the vascular handpiece called Flash, and this will allow us to treat all the superficial erythrosis and telangiectasia in a faster way, up to 2 Hertz, in a very comfort and ergonomic way. So let me introduce to you the next speaker, Professor Paolo Bonan, that will drive us through the entire laser part of the handpiece for what it concerns the Luxea device. So let me give words to Professor Bonan. Enjoy this part of the webinar.
Well, thank you, Simone, and good afternoon, everyone, and welcome back to the 4th webinar of our cycle of DEKA webinars. Before diving into the core or the second part of this webinar, let me thanks once again Engineer Paolo Salvadeo and Dr. Giustino Gallo, all the staff at DEKA and collaborators, area manager, and Simone Parenti, our moderator even today, and Vincenzo Di Maiolo for the invaluable technical support. Without further ado, let's move on with the second part and laser technologies of this platform. We have 4 lasers: Sparks with Nd:YAG, Insight with Nd:YAG, Prisma with Nd:YAG Q-switched, and Arise with erbium YAG. Well, this is a platform, and so we have at our disposal a lot of devices and sources. The first laser that we talk about is the Sparks. The Sparks is with Nd:YAG laser source, and the indication, as you can see here, are the vascular lesions of the face, of the legs, of the body, hair removal, hemangiomas, skin rejuvenation, and this kind of handpiece of Sparks is very versatile, and I want to highlight that hair removal is for all skin type. Pulse shape, we can have 3 types of short, medium, and long: 6 milliseconds, 15 milliseconds, and 15 plus 15 milliseconds. The first for the superficial vessel, 2.5 millimeter. The second for the deep vessels, for example, for the leg vessels and onychomycosis. And the third is for hair removal. Well, the way of working, we have a perpendicular wave, careful not to compress the vessel, and slanting, because we must not compress. Higher heating of the vessel is possible, greater capability of photocoagulation, and there is an involvement of higher quantity of hemoglobin. Our protocols. Well, in clinical cases of facial telangiectasias, we have our telangiectasias that are extremely fine varicose veins with a gauge of between 0.1 and 1 millimeter. They can have different morphologies, and they don't offer particular problems in the face. On the contrary, lower limb telangiectasias create problems, especially in the choice of the approaching modes, as we'll see later on. You see the spider nevus before, dermatoscopical image, and after the treatment. This we have our parameters with a spot of 2.5. And the fluence is 120 joule per square centimeter. In other case, you see before and after the treatment. Dermatoscopical image, and you can see the vasospasm of the vessel. Well, skin reaction immediately after the treatment is erythema and edema. Is a very modest edema. We have another possibility to have a darkening on the vessel when the vessel is a little bit larger as a caliber, and we can have an intravascular coagulation, so the dark image of the post-treatment. This is a detail before and after the treatment, after 1 month. And this is an important image because is one of my mistakes. This is, as you know, this is my behavior to report back to you not only the brilliant results, but even my mistakes, our mistakes, because it's important to avoid, how to avoid the mistakes. You see here in treating the vessel, there is the crusting and then an atrophy. Why we can reach this kind of bad scarring? Because I move too fast the end piece and I didn't cool down the skin. So my recommendation is to move slowly the end piece when we use in particular the larger spot size, in this case 4 millimeter spot size, because if you note in this split phase study, on the left we have 2.5 millimeter spot size and the right 4 millimeter. You see that in the left we have a very superficial scabs. Is exactly how it should be, and it is due to the fact that we have a heating of the very superficial part of the skin and the very superficial telangiectasias. The patient leaves in this situation, so it's not professional, it's less professional, but is safer. It's safer because you can hit only the very superficial part. On the right side, you can be more audacious because you are using 4 millimeter, and so it's risky because you can hit a large amount of tissue with the telangiectasia, but you are more professional because the patient leaves your office in this situation only erythema. At the end, both of them lead to the same results, the disappearance of the vessel. Well, leg vessel, there is a clear demand for laser irradiation of face and leg telangiectasias. In the laser treatment of leg telangiectasias, there can be small vessels, too technical challenging for sclerotherapy, vessels resistant to sclerotherapy, or tendency for matting. In reality, sclerotherapy and laser are not necessary alternative, but rather complementary procedure. Why? Because we must consider the hemodynamic evaluation. Because we need to evaluate the patient before the treatment. On the left, you see the patient that we are sure we don't treat directly with laser. On the right, maybe we can treat the laser. Why? Because we need a very important protocol of study before starting with our procedure. The first exam is the echo Doppler exam of the veins. The second, the direct ultrasound, and the third, the clinical evaluation. Why the first? Because we need to know if we have some problems in the depth, in the femoral systems, or in the saphenous systems. You see the tests that can be positive or negative, the squeeze test and Valsalva maneuver. The third example is when we don't have any problem in the depth. So in the first two cases, we need to solve the problem with surgery, sclerosis, or other methods. In the third case, we can treat directly the very superficial telangiectasia with our laser. Why the echo Doppler, the echo exam, the echography? Because we need to see exactly the subpapillary plexus. The subpapillary plexus is important because sometimes we need to combine the sclerotherapy with some technical problems, the sclerotherapy with laser. when we have a mother vein that is running just under the very superficial part. You see the red telangiectasias running in the superficial part and the mother veins. So you can therefore state that for superficial telangiectasia, you can use the laser, of course. Deep sclerosis, for mixed telangiectasias, integrated strategy with the first sclerosis, then laser. But we have to carry out the third step of evaluation and protocol of study. You see the upside down tree where we can use the sclerosis and then the finissage with the laser is correct. Then we have a second case, and right side up tree where we have injection can lead to the persistent matting. Why? Because in the first case, we have the sclerosis of the venule has stopped the leakage point, while in the second case, the sclerosis of the venule has stopped the drainage pathway. So it's very important to remember that in any kind of procedure that when we use light of laser, it's important the device, but it's important the word around the device. So the preliminary interview, the documentation, the diagnosis, and the post-treatment care. Not only so the laser and the light. This is our protocol and our behavior. So about the laser, we have to remember that Nd:YAG is well absorbed by the 4th peak of absorption of hemoglobin. So this gives us a possibility to treat the vascular lesions, but with a very, very low competition with the melanin, as you can see here in the different wavelengths and absorption peaks. We are in front of hemodynamics and the chromophore that is in movement, so we are sure that the laser treatment cannot be performed in this kind of lesions, but we can use the laser only after the very, very important and proper protocol of study. You see what happens immediately after: erythema, edema, blanching, or darkening, as we have seen in the first part. This is one of our patients treated with the sparks and 125, 155 joule per square centimeter, and with a pulse shape that is normally medium. And you see the detail before and after more or less 15 days, 20 days. Dermatoscopical image before, immediately after, very, very fine telangiectasia, very difficult, challenging to treat with a sclerotherapy. And then the results. After 1 week, 10 days, we can have these scabs is exactly how it should be. Again and again after 2 months. Well, the more common possible complication is the hyperpigmentation, just to highlight and remind you. You see this case. Venous lake. Venous lake is another possible indication of this laser before, after the treatment, and after 6 weeks. Onychomycosis and Nd:YAG. Nd:YAG is used and is applied in the onychomycosis. There is a rationale. So there is a selected photothermolysis and thermosensitivity of the mycetes. Why? Because we can use this particular wavelength that is absorbed by keratin, and the absorption by the nail is less than 30%. So this kind of laser can exert its fungicidal action with the denaturation of the proteins of membrane and with the production of oxidant-free radicals. This is our study, our test, where we see the loss of energy only in the nail, only 30%, and 65% reach the target, and the study in culture. Thanks to the Dr. Andrea Bassi thesis, we have evaluated and studied this particular protocol. You see the treatment, the procedure is characterized by 3 concentric movements from the center to the periphery and 3 vice versa for total of 6 steps. You see the results before and after, before and after. Onychomycosis treatment procedure. Before each session, the patient was advised to hydrate the nail plate with an occlusive bandage with 30% of urea. The interval between one laser session and the other was 15 days, preceded by direct mycological crop examination. Maximum number of treatments, 7 sessions. After this term, patient whose clinical condition was stationary or worsened, stopped laser treatment, and a follow-up after 2 months from the end of treatment with the clinical objective examination and mycological tests were carried out. These are our parameters. Well, the other two indications are the hair removal. You see the parameters, spot size 10 millimeter with a fluence of 40 joule per square centimeter and pulse shape long 15 plus 15, and skin tightening. With the brushing modality in the procedure, we have a fluence lower than the hair removal, 13.25 is a range, and the pulse shape is long, 15 plus 15. Insight is a real surprise for me because the wavelength is in the near infrared, and is able of inducing non-ablative and selective thermal damage on collagen remodeling. So this is very important because we can reach the deeper layers and the collagen, and without an important wound in the very superficial part of the skin. So we need to know the indications. We have an improvement of wrinkles, fine lines, any kind of laxity, texture, change of pores, and acne scars. The tips is that no downtime after the treatment is to report. Technique and procedure acts more deeply than erbium. It's a fractional non-ablative laser. To have similar effect of CO2, we need 3 sessions, at least 3 sessions. Interval is between 30 and 60 days with the 2, 3, 4 passes. We stay within a tolerance level. Sarcal erythema is because the cooling is in the edge is less, and we need an overlap of 30–40% between the spots. You see the pulse shape, 5 milliseconds. And this is one of our patients with a deep action, 14–18 joule per square centimeter, 5 milliseconds, 2 or 3 passes, in particular in the upper lip. I have drawn the red arrows in order to show the upward pull of the skin, the tension that we create after the treatment. And this is very satisfying for the patient and for us. Again, the risk of side effect and other mistakes. I move the handpiece too slowly. I repeated more than 5–6 passes. So please be careful. You go into the depth, but it's important to pay attention to the movement parameters and the procedure. Arise is a historical laser because the erbium YAG laser, and you see the technical sheet. The technical sheet is 2, 4, 9 millimeter spot size. With 9 millimeter, we can exploit the fractional modality of Arise, and you see the indications here. Well, with the pulse shape, we have short and long. We use short in any kind of application, 90% of cases, with 300 microseconds. And erbium YAG represents an opportunity to decrease the thermal damage observed with the CO2 laser. This wavelength is strongly absorbed by water, as you know. There is a absorption coefficient that is very, very important with this laser. And the erbium YAG laser has a loud popping sound. The CO2 has more mute sound with each pulse. There's more airborne debris with the erbium YAG, and very little gross contraction during erbium irradiation. In contrast, after the first pass of the CO2, there is an immediate visible skin contraction during the passes. There is a difference in these two laser, and so even sometimes in the indication. So you see, always short, as I said, and we can use different fluences. With a fractional, it's important to remember that we provide microscopic zone of only 300 and 600 microns in diameters delivered to the skin through a micro lens array, but we can use even this modality, as we will see later on in the combination of treatment. We can treat dermal nevus with the fluence that is lower than 2 and 4 millimeter spot size, dermal nevus of the eyebrows, xanthelasmas, and seborrheic keratosis of the scalp. I put this image because you see, after only 5 days, you have a rapid re-epithelialization of the skin and a very, very good satisfying results. Well, we can use erbium like CO2 in micro ablation with a surgical handpiece of the edge of a lot of atrophic scars, in particular the box acne scars. You see that in this case, we use Stackhoff and we use less than 2 joules per square centimeter fluence, 2 or 3 passes in the edges. And then in the same session, we can perform the fractional erbium that we have at our disposal in the platform. We are really proud about this, the results of this patient. This is a 80-year-old female, and you see a lot of sun damages. You see some scars, actinic keratosis, a large actinic keratosis in the processus areas. In the forehead, you see vertical lines, some crepus scans, and a lot of brown spots, any kind of dramatic sun damages, and the vertical wrinkles of the upper lip. We treated with a rise, and you see the dramatic appearance immediately after the treatment and 5 days after. We use in this case 2 joules per square centimeter and more than 2, 3, 4 passes in the same area. But at the end, we got a very, very good outcome if you compare before and after the treatment. You see the very satisfying results with the really high compliance of the patient 30 days post-op. You see the final results. Well, Q-switched. Q-switched is the source is NDYAG. We can treat the benign hyperpigmentations and tattoos, any kind of tattoos, and is more selective and is possible to treat different types of pigmentations and tattoos. You see the double wavelength, 532 nanometer and 1064. The 2 different wavelengths get different penetration and have different targets. You see, they will see later on in even in the tattoos. Q-switch is able to induce a selective photothermolysis. It delivers an amount of energy in a very short time, 6 nanoseconds, that gives rise to rapid thermal expansion of the target, which is shattered due to the photoacoustic effect. 2 by 2 millimeter, 3 by 3 millimeter, the spot size, and the fluence is around 4.4 joules per square centimeter with a pulse shape of 6 nanoseconds. We have a primary and secondary hyperpigmentation that we treat. The ideal therapy normally is characterized by the clearing of chromatic alteration and absence of disfiguring scars and permanent dyschromias. It's important to use a method that is capable to depict any kind of chromophore in the skin. And the software allow us to use laser in total safety and avoid mistakes when choosing the appropriate laser type. Why? I want to report back to you what we use in our protocols, in our routine. You see this patient, in particular, hemoglobin and melanin are important before starting to use the laser. This brown spot, for example, if you study the spot, there is a very poor melanin content, but rich in vascular content. Quite similar spot is instead of rich in melanin and poor in vascular component. So in the choice of laser, you have to evaluate which kind of laser you have to start to use. In the first case, we use a vascular laser. In the second, Q-switched or other laser for the pigmentations. These are our tips to reach these results without any bad scarring or unsatisfying results. Another study that is very interesting is a split phase clinical study comparing the CO2 and the 532 nanometer Q-switched one side in the same patient. You see, immediately after, we have dramatic results after the treatment with the Q-switched and less with the CO2. But in the long-term evaluation, we have after 1 month, the complete resolution of the wounds, and we still see a sort of pink pale color of the area that we treated with the CO2. So dramatic, but rapid and fast in the application. This is another patient you see treated with a Q-switched before and after, and the detail. Tattoos. We have a lot of tattoos, different types. And in the United States, but even in Europe, it is estimated that more than 10 million people are tattooed. And 1/3 of tattooed people during their lives decide to have their tattoos removed. Again, the ideal therapy, total pigment disappearance, no post-treatment scars or treatment dyschromias. We have double mechanism of action in the elimination of the pigment. We have a transepidermal and phagocytosis. This is a mechanism that you know very well. It's a process that can happen after the treatment with a Q-switch in the tissue. Not all tattoos respond in the same way to the laser treatment. Why? Because we need to consider a lot of variables. You see, smokers versus non-smokers can answer better or not less better. Tattoo's color, interval between treatment sessions, optical pigment variation, depth, density, and typology, tattoo age, anatomical area. The two target you see for 532 is the red, orange, and purple is an excellent target. And the maximum absorption for 1064 is the black and dark blue. You see the different colors and look for different penetration. The results. Fluence 4.4 joule per square centimeter before and after, before and after, before and after, before and after. Cosmetic tattoo. We have performed double wavelength for removing the black tattoos and then the pink tattoo that is due to the chemical variation of this color that is very often seen in this kind of tattoos, cosmetic tattoos. The same for the bow. You see the bow is composed by black and red. There is a combination of 532 and 1064. I want to highlight the necessity. We need the interval more than 2 months or 3 months between the session because the process in the tissue is very, very long. Well, why Luxea is important? Because the doctor's point of view is in this case crucial. Combination treatment. We can combine a lot of end pieces with this platform. For example, we can combine Prisma with the Q-switch and the rise, fractional in particular. Why? Because with the fractional rise, we can eliminate the bubbles and we can have a tissue remodeling. So we can accomplish the action of the Q-switch of Prisma is one of the combination. Then we have another combination in the fibroangioma. We can use the sparks and DIAG for treating the vascular component, and then the fibrotic component with the rise. We have seen the brilliant presentation of Dr. Michela Troiano about the combination of laser and filter, different chromophore, different targets that allow us to get the best of the results. Other combinations, insight and the rise, you see before and after 1 month. You see the great capability to restore the texture of the surface and remodel the collagen in the depth. The forehead, again, insight and a rise. Inside and a rise for the upper lip and for the cheek and lips. You see here, again, we have drawn red arrows in order to show the upward pull of the skin and tension of the skin after the treatment. You see the great capability and how we can demonstrate this tension and the great tightening of the skin that we can get with this combination. You see the double face, the double part of the treatment in the two part of the face that we treated. During the treatment, the patient doesn't report any discomfort because we go into the depth, and so we can have even a good feedback from the patient. Is not so risky as other laser can do. You see, even the color of the skin can improve. Before and after, there is a lighter skin. The pores disappears, and we get a very, very smooth skin after the treatment in this combination of laser. Again, I report back to you the use of Insight for stimulating the collagen in the depth, and the rise for microablating the border of the atrophies. Insight and Smart Sight. In the first webinar, we illustrated the qualities of the Smart Sight DEKA, the CO2, and so we can combine the fractional CO2 if you have with the Insight. So even in this case, we can combine the fractional with the fractional microablative laser with the Insight, that is 1340 nanometer. So, and the app is capable to go into the depth and stimulate a lot. Double stimulation, great results. Again, in this atrophies, you can do this. And in this acne, post-acne scars, you can combine the two ones, and even the oily skin is improved after this kind of treatment. So, in conclusion, by introducing Luxea, DEKA has changed the laser platform method landscape. Why? Because have you ever been in doubt about which kind of laser to buy first for your practice, or which one to buy after in order to respond to all patients' requests? Well, in our activity, Luxea is the answer. And in the conclusion, in a nutshell, you can say that Luxea meets patient expectations and also, and above all, physicians' requirements. Well, before concluding, what I hope and I wish is the first set of DEKA webinars. I'd like to express my gratitude to all of you fellow physicians for the high quality and high level of commitments and even participation. So thank you very much for having been with us for this over this period of the very, very severe, very hard lockdown. Thank you very much.
Thank you very much, Professor Bonan, for your complete part about so difficult matters like the laser handpieces when applied in conjunctions with other light devices are. We've been receiving just a few questions for what it concerns a few tricks our audience would like to know a little tricks about skin rejuvenations, as well as the use of the NDIAG a little bit more consistently. Can you give us a trick based on your experience in using NDIAG on a side, but also all the other hand pieces concerning the skin rejuvenation?
Well, thank you for the question, because allow us to report our experience over the past 3 decades of our story, and we start to note the results within the NDIAG by coming across a picture after the treatment with NDIAG many years ago. And so NDIAG is a great source, a great light, because it's capable to penetrate into the skin and having a scattering effect in the skin. So it's capable to involve a large amount of connective tissue. Even in this case, we have this source at our disposal. So by using the brushing modality, so you're staying a little bit far from the skin and moving the end piece, you can deliver the energy, so we can heat and create a sort of upside down thermal injury where we can heat the deeper layer of the tissue with a very good results. With this platform, we have even other end pieces. That's why I consider Luxea a winner in the possibility to manage the patient, because we can move her from one to the other end piece in the same platform by using even NDIAG for rejuvenation.
Thank you so much. Another question is relating to the inside technique. Do we need a sort of cooling support during the inside treatment?
Well, not during the treatment, because I think that if you use the proper parameters, you don't make the mistakes that they have done. They have that, unfortunately, and you follow the right parameters suggested by the company. And after our experience, even by my group, you don't need the cooling system. On the contrary, we need to heat the skin during the treatment. After the treatment, you can apply the ice pack and all the opportune procedure and taking care of the skin, but not during the treatment.
Then there's another question related to beginner, to physician that may have not too extensive experience relating the use of this kind of device, and they say, actually, are we guided through the selection of parameters on the unit, or do we have some kind of auto support, such as a manual to see protocol, especially the first time we are using the platform?
Well, I see I studied the manual. I have to say that DEKA provides a very good manual, because all the parameters and protocols that are reported are correct. So you can start from this sort of database that you can use as a starting point. Then, as you know, is our job, you can introduce your experience.
There's a question instead relating to Arise, erbium YAG. For xanthelasma, what kind of diameter spot are we going to use?
Well, I suggest a 4 millimeter for any kind of dermatological lesions. 4 millimeter is the ideal for treating. So even for xanthelasmas, you have to use 4 millimeter, because allow us to be very precise in the action, and then you can even treat the border at the end of the procedure.
That's correct. Another question about, we were talking about beginners a few while ago, and then I have another question relating what kind of technology setup are you actually recommending for a physician that is starting his practice now?
Well, you mean in the sense using this kind of platform, or in general?
Actually, this is quite generic question, so I might not able to provide you with more details.
Well, I think that this platform is perfect, is suitable to be used, especially at the very beginning of our activity, because offers a lot of end pieces. We can have a very important curve of learning by using the different pieces and even the tips that all the consultants and even the engineers and the physicists that work in DEKA have written down in the manual. So I think that is a very, very important platform, and luckily we have at our disposal, even just for the very beginning of our activity.
I do confirm we're talking about a platform. So do we have any practice suggestion on a sort of initial I don't know, setup we might suggest? For example, kind of, I don't know, dyed laser plus lilac IPLs that is pretty much wider in the use, or kind of varieties specific for vascular together with a diode and an IPL, just to have a wider window of usage in order to see the initial business how might proceed ahead, and then to decide if to go deeper with investments on other modules. What do you think about it?
Yeah, I think this all these combinations are important. It can be very, very effective, and that's why we use this platform. We choose this platform very often in our daily activity. We have mentioned a lot of possible combination with different targets or with the same targets, but at different levels of in the tissue. So we have actually a great opportunity with this platform to move our activity in the best way.
Okay. All right, another question about what's the best combination for red face, telangiectasia, I suppose, and rosacea?
Well, I think that the Dr. Michela Troiano can answer to this question, and maybe even with other questions that where we have to use any kind of light, that DEKA provided with this platform. So if you don't mind, I give the floor to Dr. Michela Troiano for answering to this kind of with this kind of questions about the use of different type of IPL.
Okay. So now we are getting connected to Dr. Michela Troiano once again in order to proceed ahead with a set of questions that are mostly relating to the use of the lamps, as well as the kind of comparison, which is our other kind of existing technologies for skin rejuvenation practices. Thank you, Dr. Michela, for joining us again. And let me proceed with the first question, that is relating the best combination under your statement for treating red face, rosacea, and telangiectasia.
Well, we used to use the Viridis, which is a 500G, or eventually the lilac. So maybe if you have the lilac, which meets more patient needs, you have the possibility to use the 500G again, because this filter permits to avoid the non-vascular wavelengths. So we have the possibility to it's more selective. Okay, so the 500G is more selective for hemoglobin, and so in this way we can treat erythrosis and facial telangiectasia. If you have very small vessels, maybe in some difficult areas, such as I showed you before, in the area of the nose, it's better the use of the Viridis. What is important when we have to treat vascular lesion is not to press too much. Otherwise, we can reduce the effectiveness of the treatment because we press the vessels. But to answer to your question, the lilac and Viridis both at 500 ng per minute to treat vascular lesions.
Okay, and this looks like to be one of the best advantage in using the 500G technology over this kind of handpieces that allows the application of that over difficult area in a way. What's your approach with these kind of handpieces concerning the ergonomic aspect? Are they too heavy or are they pretty handy to be used even for several treatments in the same day?
Well, no, we have to wait. It's not possible the combination of the two sources in the same day. So we have to start with the end piece, and then we can perform after about 20 days. We can treat with the other end pieces. In general, what is important is the area reality to treat. So if we have to treat a small area, we have Viridis, which has a very small area of treatment, and it's easier to reach difficult areas. So the difference in reality depends on the area we are treating.
Okay. Okay. I've just received a question about the skin rejuvenation technique. Okay. And the audience is asking, compared to an Nd:YAG laser that is used to perform skin rejuvenation, how do you place the Luxea handpieces in comparison?
Okay, we used to work a lot with Luxea, in particular with the LILAC and piece, the SA, because it gave us the possibility to have biostimulation. Because we are in the near infrared light, and these permit us to produce a high quantity of collagen. So what we used to do, we normally use the SA for a photo rejuvenation with no vascular lesions, with no spots. But if the photo aging is worse, we normally use inside to treat skin rejuvenation and even scars. For example, if we have an acne scars, the Nd:YAG is another possibility, sure, but we normally work using these end pieces.
Okay, sounds good. Concerning other hand pieces like Maruber, for instance, or simply other ones like SA, in terms of the skin rejuvenation, what's the criteria of choice in between the several options that Luxea is offering to the users?
I'm sorry, can you repeat your question?
Sure, absolutely, yes. Concerning the skin rejuvenation options that Luxea offers to the users, I'm thinking about the SA handpiece, I'm talking about the rhubarb, talking about the lilac handpiece, and others. What's your best suggestion or your personal experience with a different choice that the machines offers?
For the SA offers you the possibility to treat acne and to treat photo rejuvenation. You spoke about rhubarb, right?
Yes.
Okay, but rhubarb is more selective for other problems. So it's used for hair removal. So I didn't understand your connection between rhubarb and and SA.
No,
Sorry.
no connection rather than to report the question as it is. So that's it. For what we concern instead hair removal, okay, with lights device, concerning the different skin types that we have, what's your experience with the different hand pieces?
Okay, well, we have two different filters. So we have a 550 and we have a 755. So we have to, it's possible to use both of them, But when we have to treat darker phototype, we suggest the use of the motion technique, because the motion technique permits to work even darker phototype, reducing the energy and avoiding any cytokine effects.
Okay, that's good. All right. So at this point in time, we don't have any other questions. So let me thank you once again, our valued speaker for today, Dr. Michela Troiano and Professor Paolo Bonan, that so professionally joined us in the Luxea journey today, taking us through the entire webinar and providing us with all the details, information, and tricks about the use of this outstanding and beautiful platform that might include several treatments and allowing beginners and experienced users with different options and huge possibility of differentiating the business. For what it concerns myself, let me thank the technical team here. Firstly, Mr. Vincenzo Di Miolo that make all of this possible. The guys behind that connected us over the web. And very important to thank every one of you for assisting the webinar. Thank you very much and enjoy the rest of the day, everyone.